Q&A is the...
Okay, so we'll just have a... How long do you want for Q&A? We're about 13 minutes behind. You want to do it full 10 minutes and then make it up a little bit later? Okay, so let's open up the Q&A. Adriana, who is helping us with all the technical stuff, wizardry. Thank you, Adriana.
So, does anyone here in Sydney have questions?
Let's start with the folks in Sydney. And if you would like to submit questions online for the rest of you who are watching virtually on Zoom, please type it into the Q&A box. Thank you. But we'll have a runner. Adriana, please.
Can you say who you are, please?
My name's Leslie. I'm from Darwin.
And welcome, Leslie from Darwin.
First of all, just say congratulations on the research. It's really wonderful to see that coming through. That's just based on the results that you're getting, so it's really wonderful. What my question is working with the local sleep physician in Darwin, she's quite in tune to the benefits of maxillary expansion, but it's not commonplace for her to recommend it, mainly because first treatment option is A's and T's, and that typically keeps the parents happy, and a lot of the time they come in, they go out happy days, with relapse, minimal. So it's kind of like how do we approach that to talk to the sleep physician, also talking to parents from her point of view, to kind of look at it from a more global point of view and how to help the kids, as much as we can.
Okay, so your question is that your sleep physicians tend to focus on surgical interventions, tonsils and adenoids, and that rectifies the serious health concerns and keeps the parents happy, but you don't know how you fit into that equation or how to get the ball rolling and referrals and so on. Is that correct? Okay, so we will cover that, how to interact. But one thing that I want you guys to really focus on, there is no evidence to show orthodontic appliances can correct sleep disorder breathing, okay? So that's not how we lead, all right? We're here to support sleep physicians by screening for sleep disorder breathing and referring to them,
Yes.
Okay? Then what we do is we ask that when they're finished, they return the patients to us to see if there have been any orthodontic side effects from this sleep disorder breathing that we might help with. Because our job is to make the structures balanced. Our job is to teach the children how to use those structures. Yeah? And how are we to work if they can't breathe through their nose? Well, we can't. So that's how we interact. There's something called primary care. We understand that, right? We have to do primary care before we do all the aesthetics, yeah? You can't put veneers on when there's active decay, yes? Primary care, decay management, gum health management, yeah? Vital function management has to be corrected before orthodontic management. So we recognize who is higher in the level of importance, and we refer to them so that the child's vital function issues are resolved. Then we tidy up. Our job is to tidy up all the side effects. And then when you start referring patients who are qualified, see, what does a sleep physician or an ENT not want from you? Someone who doesn't need treatment. Oh, not that tire kicker dentist again. You want every patient you refer to be operated on. But your job is to screen out the ones who don't actually need treatment. It's only about 15% of the kids that you treat who actually need surgery. Your job is not to send the other 85%. If your job is to send 100% of every kid that walks through your door, you will be the tire kicker dentist. Your job is to screen out the 15%, send them off, and every one of them gets the surgery, and when they've done the surgery, they will write back to you saying it was successful. Thank you very much for sending this child. And then your job is to follow up the parents. How's it going? Come on in, let's have a look to see if there are any orthodontic side effects from all these years of sleep disorder breathing. Okay.
Any other questions here?
Thank you, Simon, for that. It's great morning. Name question from Sydney. My question is, so with nasal breathing, where you've got kids who have got nasal breathing and are mouth breathers, and I send them to a couple of ENTs who do appreciate the structure where dentists could be involved. However, where I struggle is when they recommend surgery, but the parents go as another option, and it's often allergy-based problems. And this is where the compliance is very poor. So they come back and try to manage the allergy. And the patients or the kids get lost in the system because it is a high compliance thing to manage allergies. What do you do in those situations?
Okay, so your question is, a lot of the mouth breathers have allergic issues with their nose that cannot have a simple intervention. And the answer is, yeah, it's not easy. Like often, you know what the only real solution is? Move. Move to somewhere where you're not allergic. All right, find a place that you can live where your nose isn't running. That's better than anything you can do for them. The answer, of course, is most people say, I can't do that. And then you say, well, you have to accept the compromise. That's just the compromise of life. I'm short. I've accepted that. I'm not going to play basketball. I might want to play it, but the best thing is just for me to watch it, right? There are some things, we can't save the universe. It's not our job. Now, what I want to make sure with the questions is that they need to be relevant to the segment, because I will be covering all this in other segments. You've got the program in front of you. There'll be bits on nasal. There'll be bits on ENT. This is literature review, so ask literature review questions. And at the right time, ask the questions that don't ask what's at the front of your mind because that's the patient you've got. Ask the questions that are relevant to the topic that I've just covered. Okay, you've got to organize your mind so that it has a progression of logical steps, because that's what I'm going to teach you to do. I'm going to shut you down when you jump ahead and say, let's stick to the topic. Good? Excellent.
Okay. So
any questions online? Otherwise, we'll move on to the next.
We had a question, are there any of the PowerPoint slides available for reference? I said yes, we will provide the slides, downloadable resources and recordings inside the Teachable platform, which you should have access to. Email us if not. The recordings and resources and downloads and slides will be available within 1 or 2 weeks. All right.
Yeah, everything is recorded and will be available, and all the slides will be available as PDFs.
All right. So let's move on. Let's end the Q&A here. We'll have more Q&A later today.